Moms in Motion, and we wanted to have this opportunity with you all to talk with you a little bit about the changes that we've seen coming to EPSDT and the PCA services. And I know there's been a lot of information and some confusion about some of it, and we want to let you know what we know. But with that being said, just a few ground rules here. So you all should be able to see my screen. So we'll be going through the presentation on here tonight. A few things first. So we don't know all of the answers. This is a new method of authorization for all the personal care hours, and we are going to do our very best to tell you what we know as of right now. That can change, and we are not necessarily the experts on it, so we don't know everything. So we'll do our best to tell you what we know, and hopefully we can all come together to help one another. So we do want to work together to make sure that you all receive the services that you need in the community. Please hold your questions until the end. We should have time to answer those. We received a lot of really great questions on the sign-up form. And so we've incorporated those into this presentation. So we will be going through those throughout the presentation, and then at the end we should have some extra time to answer any other questions that you have. So if you will hold them, I know there's a chat box on here, but I am just not good at reading the chat while talking, and I'll end up missing you. So if you'll hold it to the end, that will be the best way to get your question answered, because then you can make sure that I know that you're asking it. So we'll get to those here at the very end. So let's go ahead and get started here. So kind of what's the scoop, what's going on here? On July 11th, a Medicaid memo was released, and it stated that starting September 1st, 2018, those that were on the CCC Plus waiver, so that's formerly the EDCD waiver, and that are under 21 years of age, EPSDT would be used to authorize their attendant care hours. And if you're already like, wait, I'm lost, don't worry, we'll break it down for you. So EPSDT stands for Early Periodic Screening, Diagnostic, and Treatment. And this is not, EPSDT in itself is not new. It's new that we're using it to authorize the personal care hours for the CCC Plus waiver, but it's not new in of itself. So previously, probably it was used for your child and you didn't even know it. It's used to fund things such as dental work, vision care, assistive technology, and a broad range of other services for children under 21 years of age. And now they are going to use it to fund those attendant care services as well. So what this means to you all is that there's some separate paperwork that will need to be obtained in order to get those authorizations processed correctly. And we're going to go through exactly what that paperwork is, what it looks like, and kind of the process for getting it back to where it needs to go tonight. So what's the impact? Hopefully, more funding will be available to serve the community and allow more people to receive community-based care. So that's our hope. New forms called DMAS-7s will need to be completed by primary care physicians for all the individuals under 21 on that waiver to reauthorize the care that they're currently receiving. And we're going to break out what that looks like as well. There is a potential for a lapse in services. We want to do everything we can to avoid that. That's part of why we're having this webinar tonight. But there is a potential for that lapse if we have to wait for the proper documentation to submit that reauthorization, and we'll talk more about that as well. So some of the individuals who require less assistance and previously qualified for attendant care under the EDCD CCC Plus waiver could potentially not meet the requirements under EPSDT. That is a potential impact. Individuals under 3 years of age are also at risk for a reduction in services because of the structure of the DMAS-7. We'll talk a little bit more about that as well. And individuals must use a service under the CCC Plus waiver every month in order to keep their waiver. So we'll talk about what those services are and how you can make sure that you are using the waiver to its potential. So what does this look like to you? So if you are currently on the CCC Plus waiver, you have a child on the CCC Plus waiver, and you're wondering, what does this mean to me? That's what we really want to look at tonight. So you will need to get something called a DMAS 7. It's a form that can be found on our website. So you can also get it from your service facilitator. So your service facilitator should be coming out to see you regularly. You can get that DMAS 7 from them, or if you have the ability to do so, you can go to our website. It's www.momsinmotion.net, and you can get that blank DMAS 7 form right off of the EPSDT section. So if you want to download it yourself, you're more than welcome to do that. Make sure you go to momsinmotion.net. Momsinmotion.com is like a bunch of moms doing exercises, and I really wish that was me, but it's not. So go to momsinmotion.net, that's our website, and make sure that you download that DMAS 7 or ask your service facilitator for a copy of one. That will then need to be taken to the doctor, and we'll talk a little bit about that here in the next few slides. And then after the doctor completes it, you will need to follow up with the doctor to make sure they complete it and send it back either to you to give to your service facilitator or send it back to us. And then we submit it along with our documentation that we have to pair with that to the authorization team. So we'll talk in more detail about each of these steps. So more about this DMAS 7. So this is basically a referral form from the physician for those community-based services. It needs to be completed by the pediatrician, the developmental pediatrician, or a family practice doctor. According to the Medicaid memo, and those are public, if you search for Virginia Medicaid memos, you can see those. But according to the Medicaid memo, it cannot be completed by a specialist at this time. We have heard some rumors that maybe it could be, and we're seeking some clarification. But as of the written documentation that we have right now, it needs to be completed by either a pediatrician, a developmental pediatrician, or a family practice doctor. It can be signed by someone who's an MD, a PA, or a nurse practitioner. So an easy way to kind of think about this is if they can write a prescription, they can sign this for you. But if they can't write a prescription, like that awesome nurse that checks you in at the doctor's office every time, she would not be able to fill out that form for you. So you want to make sure it's someone that could write a prescription. So MD, PA, or nurse practitioner. The physician needs to have seen the patient within the last 90 days from when they sign it. Once they sign it, we're told that it's good for a year. But they do have to have seen the patient within the last 90 days from when they actually sign it. So the easiest way to do this, honestly, is to make an appointment and have the paperwork completed at the visit. If you've seen your doctor recently and you're able to talk with them, you may be able to get that form to them and have them fill it out. But if you haven't seen them recently or they're hard to get a hold of, sometimes it's just easier to make that appointment and go. And I know that a lot of times we have a lot of appointments going on, and it's like, oh, one more appointment. But that is usually the easiest way to get that taken care of. So if you're thinking about your appointments, because I know that all of these pediatricians, developmental pediatricians, well visits tend to book kind of far in advance. So if you're thinking about your upcoming appointments and you have an upcoming appointment with developmental peds or a well visit, take that paperwork with you and get it completed at that visit, because that's usually the easiest way to get it done. And communicate with your doctor, and we'll talk a little bit more about that communication here coming up. We are getting just a little bit of audio feedback, so if you are on here and you're not muted, if you can mute yourself, that will help us avoid some of that feedback so everybody can hear. So the communication piece is really important when it comes to this form. It's important for you all to advocate for the services that you need. The physicians are doing their best to help with this, but we've talked with several of them, and they've really received little to no training on completing that DMAS 7. So some of them, it may be the first time they've seen this form, or they're just not very familiar with it. So what we did was we took a DMAS 7 and we made a sample that just explains how to fill it out. and we put that on our website as well. So if you go to momsinmotion.net, there's actually a sample DMAS 7 that you can share with your physician so they can see how it needs to be filled out. It goes through the different sections. It lets them know which sections need to be completed by them, what we're looking for on different dates, kind of some clarity there. So we're hoping that that will help the physicians be able to complete that form. A couple important things about this form. Make sure they fill out every single area and leave nothing blank. Sometimes we get them back and like half of it's filled out, and we can't submit that, unfortunately. So then there's a lot of back and forth with the doctor's office trying to get them to go ahead and complete the rest of it. So if you are taking the form to your physician and they give it back to you and it's not completely filled out, please make sure they fill out every single area. There's a couple areas that we often miss that have to do with dates and their MPI number. And then we also need them to sign it, not stamp it. So that's a few things that we have figured out as we've kind of gone through this transition a little bit. EPSDT requirements are that a child has dependencies in at least 3 activities of daily living to qualify. And so that is something that they will be looking for on that form as well. So make sure that you have a real frank conversation with your physician about exactly the level of care that your child needs. You know, a lot of times physicians see your child in a doctor's office for a few minutes in order to treat their acute illness or you know, their ongoing development, but they aren't necessarily having conversations with you all about their community-based care services. So this is the time to have that conversation with them and make sure that they understand as you go through your day what that looks like with your child. If they require different levels of assistance with things like bathing, toileting, getting dressed, you want to communicate that with the physician so that they can get this form filled out accurately, because we really want this form filled out by the doctor to be a true picture of what your child looks like at home and what level of assistance that they need, so that then we can request authorization for the level of care to best serve your child. So you want to communicate that level of assistance that your child needs with those activities with your physician. And also, if you have been previously receiving services, communicate that schedule of assistance that you currently receive with your physician as well. There's a spot on the form for the doctor to fill out basically a prescription for the schedule of care that your child needs. And so if we are seeking reauthorization, it's super helpful if they match up the schedule you currently have. And that way everything kind of flows well on the paperwork side of things. So communicate that schedule of assistance you currently receive. What we don't want to happen is for you to be receiving, you know, 25 hours a week of care and your doctor not realize that, and they put that you need 10 hours a week of care, and then that creates kind of a lag in getting that paperwork corrected so we can get it submitted. So you want to make sure that you have that conversation there. So communication is huge. There are some potential hurdles with the DMAS 7. So I'm a straight shooter, so I like to tell you kind of what we're seeing and what are some different hurdles that we've run into at this point. Physicians, as we mentioned, are experiencing some confusion on how to complete the form. They get a ton of paperwork every day, and sometimes it's hard for us to get that DMAS 7 back quickly because they just have so many things that going on between referrals, insurance paperwork, sports physical forms, school physical forms. There's all kinds of stuff that they're dealing with on a day-to-day basis, and so they just have a ton of paperwork, and sometimes it's hard for us to get that form back quickly. The other thing is some of the children, and you guys may be sitting here thinking this about your own child, some of the children with more medical complexities don't see a pediatrician regularly, and they may follow up with specialists all the time. At this time, the specialists, we've been told, according to the Medicaid memo, that they can't complete that referral form other than that developmental pediatrician. So if you see, for example, if you see a pulmonologist every 3 months, but you haven't seen a pediatrician in a year, you probably are going to need to make an appointment with that pediatrician for the purpose of getting this completed. So you want to make sure that you kind of pay attention to when's the last time your child saw a pediatrician that could fill this out. So some families, as we just referenced, may have to make that extra appointment to get that paperwork completed properly. And then finally, authorizations can lapse if this is not received in a timely manner for the reauthorization request to be submitted on time. So we've been trying to start this process about 60 days before your authorization ends to try to give plenty of time to get that form filled out for us to do our portion of it and get it back to the people that authorize services on time. And so we are trying our best to do that ahead of time, but sometimes, you know, just due to different circumstances in life, it's hard to get those forms back on time. So sometimes there can be a little bit of a lapse if we don't receive things back in time. So that's where you guys can really help us getting this form back, and we'll talk a little bit more about that. How does this impact other waiver services? So in order to remain eligible for the CCC Plus waiver, individuals have to use a waiver service at least once a month. Now that attendant care is being authorized under EPSDT, it's no longer considered a waiver service. It's carved out under another service line there. So the easiest way to maintain the waiver is to use respite care each month. However, if you don't receive respite, you can use a different waiver service. So you're probably wondering, what are the other waiver services? There are several of them. So assistive technology, private duty nursing, environmental modifications, medication monitoring, PEERS, the personal emergency response system, transition services, adult day healthcare, and then respite care. So a lot of times you can use any one of these and qualify. Most often the kiddos that are going to be impacted here also receive respite services, and so that tends to be the easiest way to meet that criteria to maintain that waiver. But if you for some reason don't receive respite, have a conversation with your service facilitator about your other services that you're receiving. But here are some other options that you can be using as well. So how can we collaborate? How can you guys help us help you so that we can all do this together? So we all have the same goal in mind. We want to make sure that anyone that's eligible for these services is cared for both before, during, after this transition. So help us get that DMAS-7 back from the physician offices. That seems to be our biggest hurdle at this point. So if you can help us get that form back from your doctor, that is huge. Understand the importance of communicating with that physician, making appointments if necessary, and obtaining that paperwork to prevent a lapse in services. We try to send it out ahead of time. We try to notify you guys ahead of time when your authorization is ending. But if we don't get that form back, there's not a lot we can do at that point. We're kind of just waiting until we receive that form. So definitely communicate with that physician and help us get that back. Also, communicate with us. Let us know if you are missing the paperwork so that we can collaborate to help get reauthorizations pushed through. A lot of the MCOs, your care coordinators, they're willing to help talk to doctors' offices, see if they can get that form back. They've been really great working with us. And so if we know that, you know, if you've called and you've faxed over the form and you left a message, but your doctor's on vacation for the next 2 weeks and you're not sure if it's going to be back in time, let us know, because we can proactively try to do things, no guarantees, but we can try to do things to help avoid that lapse. But if we don't know about it, it's harder for us to fix it after it's lapsed. So if we know about it ahead of time, that helps. So if you are like, I've tried to get this DMAS-7 and I haven't been able to get it back yet, what can I do? Talk to your service facilitator, because that's exactly why they're here, is to help you with those services. And so that's definitely who you want to communicate with to see what we can do to kind of come together. So I know that's a lot of information, and so we got a lot of really great questions on that form that you guys filled out when you signed up for the webinar. And so I want to go through these because most likely if one person asked it, the rest of you are wondering. So we're going to go through these and then we'll have time to open it up for questions that you guys have. So the first question here, are attendant notes required? Not at this time for consumer-directed care that's being reauthorized. They can request it if they want some clarification, but at this point, it's not being required. When will my child be impacted? So thankfully, they are doing this according to the child's reauthorization date. So you can find that by going to the PPL portal if you are receiving consumer-directed care. If you don't know how to check that authorization, ask your service facilitator and they can show you exactly how you can pull it up in the PPL portal. So definitely ask them that at your next visit. So if you, even though it was effective September 1st, if your child currently has services authorized through March, that would be when they would be impacted. So it would be whenever their reauthorization date is. And your service facilitator can help you look that up in PPL. Is there a change in the number of weekly hours that the child has for attendant care? There can be. So as service facilitators, we can make recommendations. So we come into your home, we interact with you and your child, and we review the paperwork and we make recommendations back to Medicaid. But we are not the ones that make the authorization decision. So we try to work with care coordinators and reviewers to advocate for what's most appropriate for that individual. And we do our very best to meet that. And a form filled out properly by the physician is super helpful with that. But if we're being real honest about it, we don't have any control over the number of weekly hours that they get authorized. All we can do is recommend. So there can be changes. And that's true not just of EPSDT, that's true anytime your services are reauthorized. There can always be a change in the number of hours. So there's no guarantees there. So there can be some changes. Can you explain how this impacts respite hours? So respite hours are still going to be authorized and used just as the way they've always been. So this EPSDT piece of it is for the attendant care hours. So your respite is exactly as it has always been. Why the change? So what we have been told is that it's due to funding. So there was some funding in EPSDT, and then there was not funding other places. And so hopefully this will allow more people to receive those waiver services throughout the state. And it's also to empower families to take a proactive role in their services. So now you get that opportunity as well. How long does the whole process take start to finish? This really depends on a lot of different factors, most importantly that physician getting that form back to us. So we try to process everything within 24 hours after we receive it, it's corrected, and we've completed our end of paperwork. So we try to get it back as quickly as we can, but if we have to send the form back to the doctor or follow up to get that back, that can impact the authorization time. And sometimes Medicaid will come back to us and say, you know, we've reviewed the request and we have some questions and need some additional information. And so sometimes we have to contact you guys to get that info, or sometimes it's information that we have that we can submit to them. So that can impact the turnaround time too. So that's really hard for us to answer. It depends on a lot of different factors, but we do try to process things just as quickly as we can. What if there's a gap in my authorization? So we try everything in our power to prevent a lapse in services. We try to inform you ahead of time as to when your services are ending. We try to coordinate with those care coordinators, and we try to work with your physician. But if we don't receive that DMS-7 back in time to submit it, there can be a lapse. And unfortunately, there's not a lot we can do about that piece of it. In the event of a lapse, your personal care attendant would not get paid during that time. And that's something that's beyond our control. And so we want to try to avoid that if we can. So you can help us avoid that by obtaining that DMS-7 from your physician prior to your authorization ending. How will they handle young adults who may reach 21 before their next annual? Since this is being done by the annual renewal date, if they are turning 21 and aging out of EPSDT before their next annual, they will not be impacted. Somebody asked, how do I get on this waiver? So it can be a little confusing because we have these acronyms for all these different waivers and services, and sometimes you need like a cheat sheet just to figure out what you're talking about with all these different letters. So this is actually not a separate waiver. It's a program or a pool of funding. So you can think about it like a bucket of funding. So it's not its own separate waiver. So if you are currently on the CCC Plus, or formerly the EDCD waiver, your personal care hours are now going to be authorized through EPSDT on your next annual renewal date. So that is something that will switch over, and then we'll need to get that DMAS 7 form from your doctor. If nothing has changed with the individual, will they likely keep the same amount of approved hours? So we touched a little bit on this earlier when we talked about possibly seeing reductions. We hope that they will keep the same number of approved hours. We are seeing a large number of reductions in those hours, though. We encourage you to communicate well with your physician to get that paperwork filled out properly to help avoid that. On the CCC Plus waiver, are there circumstances where DMAS provides the EPSDT service instead of the MCO? Yes, so there are a few populations that are carved out. HIP and HIP for Kids are two of the bigger ones that that we deal with. And so if you are in a carved out population, so you did not transition to an MCO, then your hours would still go through EPSDT, but it would be someone else that authorizes it. So it would still be, you're still impacted by EPSDT, but it would be approved through KeyPro, which is the DMAS reviewer, instead of the MCO. How thoroughly does the DMAS 7 need to be filled out? Every single section. So our sample DMAS 7 should help with that. It's highlighted where they need to fill it out, but they need to fill it out completely. And so if you can just look over it when you get it back and make sure all of it is filled out, that will help a lot. What if your child is younger than 5? Honestly, we don't know yet. So we are new to some of this as well. So we started requesting reauthorizations for those people that were impacted on September 1st. And we haven't gotten a whole lot back yet to really tell exactly how it's going to trend for those that are younger than 5. What we can recommend is writing a statement about your child to be included. You can also ask the doctor to write a supplemental statement explaining why the child needs services and how they are different from a child their age that is developing typically. On the form, I know that it says, like for things like bathing, it would say not applicable under 3 or under 5. If you have a child, let's say that you have a 2-year-old who needs extensive assistance with bathing, and it's because of they're impacted to where they are different from a child that is their age that is developing typically. So all 2-year-olds need some kind of assistance in the bathtub and would need to be supervised, receive some hands-on assistance, would need help in and out of the tub, turning on the water, that kind of thing. But if you have a 2-year-old that's unable to sit up and needs a bath chair, and 2 people need to bathe them and they need oxygen while they're being bathed, things like that, that would be vastly different from a child their age that's developing typically, you can include a statement or have the doctor write a supplemental statement to explain that. So that way, the people that are reviewing this request for authorization, request for services, have the opportunity to really see the true picture of the level of care that your child needs. And that's what we recommend for those kiddos. How does the DMAS 7 get to the MCOs? So you can ask your physician to complete it. So it's on our website, so you can take that to them, or you can get it from your service facilitator. And then if the doctor hands it right back to you, you can give it to your service facilitator, or if we have the opportunity to serve you and we do your service facilitation, they can fax it directly to us, or you can fax it to us. Our fax number is 703-468-4958. So that's the best way to get it back to us. How often does it need to be submitted? So we've been told that it's good for a year. However, anytime there would be an increase in hours, like a lot of times our kiddos need extra hours during the summer when they're home from school, you would need a new one anytime there's an increase. But if things don't change, it should be good for a year as of what we know right now. A big question we've seen a lot of on our Facebook page and in some of the different chat groups are those on HIP or HIP for Kids excluded? So this got a little confusing because those currently on HIP or HIP for Kids are an excluded population from that MCO open enrollment, but they do still need to go through EPSDT for their authorizations. The only difference for them is that someone different, KeyPro, would authorize their services rather than an MCO. So Medicaid's over everybody, and then the different MCOs can authorize services if you are enrolled with them. And if you're not, if you have straight Medicaid, KeyPro would be the one authorizing your services. But either way, anyone that's under 21 would need to go through that EPSDT program, whether you're in one MCO and another MCO and straight Medicaid. If you have the waiver and you're under 21, you would need to go through EPSDT for your personal attendant care services. Should you gather supporting paperwork from both the pediatrician and developmental pediatrician? It's only required that one doctor fill it out, but you can never have too much documentation. So if you go see a different doctor and they can provide you with some supplemental documentation there, the more the merrier. So feel free to submit that supplemental documentation as well. Is it possible to qualify for attendant hours and not respite? Yes. So the purpose of those 2 hours and those 2 service lines are a little different. So respite is designed for relief of the unpaid primary caregiver, and attendant care is for assistance with the activities of daily living. So they're kind of for 2 different reasons. A lot of kids have both of them because they do have an unpaid primary caregiver that needs some respite relief. So most children have both, but you can have attendant hours and not respite depending on the situation. So if you're not sure what you have, ask your facilitator and they can help you figure that out. Do I need to provide all doctor's notes? No, at the rate that your kiddos go to the doctor, that would be a lot of notes. So don't worry about providing all doctor's notes. If they complete that DMAS 7, that's great. If they want to include a little note, a paragraph about your child to go with it, that's great too, but we don't need all of their doctor's notes at this time. At what age can you enroll your child? So this is not something that you can enroll in. It's a pool of funding through which DMAS will authorize the services. So it impacts those children 0 to 21 who have Medicaid and need that personal care assistance. And this is something where DMAS would then authorize their services through that. So it's not something where you have to go separately enroll your child. It's not like getting on a waiting list or anything like that. How does this differ from the CCC Plus waiver? So EPSDT is not a waiver on its own. It is that pool of funding that's utilized in conjunction with that CCC Plus waiver for attendant care services. Before September 1st, it was used for other things, sometimes school-based care, other things such as glasses, dental services, some preventive type services, assistive technology, environmental mods. So it was used for some other things prior to this. So EPSDT itself is not new and it's not a waiver. It's just a different pool of funding that's now being used with that waiver where it wasn't prior. So I know that's a lot of info, that's a lot of questions. We do still have some time left. So you can unmute yourself and we can see what questions you all have at this time. So you're welcome to pop in and ask your questions. You can type them in the chat if you would rather do that. Okay, so has there been a change in the regulation? So a Medicaid memo came out on July 11th, and that is what came to affect this carve out. So that's kind of how this came about. So EPSDT actually doesn't have regulations. It just has a a manual. So there's no actual change in the regs, more or less, but there's a Medicaid memo which supersedes that. So good question. Thank you. What's the deadline to get this submitted? So it depends on when your authorization ends. So you want to work with your service facilitator to check PPL to see when your service line ends. So for example, if your service line ends on December 1st, then you would want to get it submitted prior to December 1st of this year. But your service line may not end until May of next year. So you need to look, it's different for every child. It depends on when their original intake was done, when their services were authorized. There's a couple different factors there. So you want to check the PPL portal to see when their current authorization ends. If you don't know how to do that, ask your service facilitator to show you at their next visit. They'll be happy to do that. Okay, so my daughter turns 21 in April. Will she have to utilize EPSDT? Her new plan starts in July. She shouldn't, not if she turns 21 before her new plan takes place. Let's see, Ability Unlimited, you want to use AT services. We'll follow up with you, and you can email that training email that sent out the info for this call, and we'll get with you on that. Are there changes for kids on the DD waiver with attendant hours? So the attendant care for anyone under 21 through the waivers is impacted by this. All right, someone else said, my daughter is 4 and the form has already been sent back to the SF. Should I send a note now saying why she needs extra help? You know what, it never hurts. So the more information that we can give back to the people that make the decisions, the better off we are. So we try to give information. So we actually try to write up something as well called a justification to explain to the people making the decisions why the child needs the level of care that they do. And so any information that you guys can give us to help with that is very helpful, because you're the ones that live that life every day and you know best what your child needs. So you're the expert on them. And so any information that you can share with us is great. Will respite hours, if authorized, still be 420? It's 480 per year. So that everything with the respite hours stays the same as it has previously. They're not impacted by this. Just to clarify, I request and take the DMS 7 to my doctor and fax it in. I was told by my SF not to worry, that we were completing and sending for me. My child's end date is 6/30/19. I have until then. Yeah, so you have until next year. That's probably why they told you not to worry about it right now. But yes, you would take that form to your physician to have it completed, and then you wouldn't need to necessarily have that done until that time, because you currently have services authorized already through June. Level of assistance amount times, is it the same as before? Does having a tube or trach still get the patient more hours? So with EPSDT, there's no minimum or maximum, so it's a little different from before. Nothing automatically gets you more hours. We can make that recommendation to Medicaid, so we would certainly still try to do that. What information needs to be written for functional description of each diagnosis? For instance, my child has several diagnoses and they cross over in many ways. I can write a novel. The more information, the better. So the more that you can tell us, we use something called a justification. So we just kind of explain basically what it looks like for each activity of daily living. So, you know, if we talk about bathing, for example, and your child has some functional deficits there where they are struggling with bathing physically, if their behavior then impacts their physical condition as well, we want to make sure that we really cover all of those things. So if they are maybe just really opposed to showering and that behavior then impacts their ability to bathe, we need to know that as well. So as much information as you can give us, that really helps. Someone said, I've always used attendant care hours, but not my respite. Should I now start using my respite hours instead of PCA? We recommend that you use your respite hour at least 1 hour a month to maintain your waiver services. You want to be using a waiver service at least once a month. So I would recommend you try to use your respite. You can get some relief for your unpaid primary caregiving duties. What does resist care mean on the physician form? So that's one of the behavioral categories. So if the child is resisting care, maybe it's really difficult to get them to take their medications. Maybe, for example, we're trying to get them to bathe and they are very opposed to it. We've seen this a couple different times. Or, you know, maybe with dressing, they really don't want to wear clothes. We have a lot of kiddos that are impacted by the different behaviors. So sometimes resisting care can be a way that manifests itself as well. There's no discussion at this point that I'm aware of respite service standards changing. So that may or may not happen. I never know what will happen until it happens. So there's no talk that I've heard about it at this time. Is PPL going to continue to be the fiscal intermediary for DMS? As of right now, they are. So if it changes, we will try our best to let our families know as soon as possible. But right now, they are still the fiscal intermediary, and then any changes, we'll do our best to let you know about it. I'm not sure about the CSBs and their funding. I can't speak to that. Okay, so someone was asking 2 different end dates, one for respite, one for PCA hours. So since we're talking about reauthorizing PCA, that's the authorization end date that you want to look at. So that's the one that would be impacted by that authorization. In PPL, when you pull up your child, you should be able to click on authorizations and see exactly when it ends. But if you have more questions about that, ask your service facilitator at your next visit to show you how to check that. We automatically have to fill out, so someone asked, can I get Moms in Motion to provide a recommendation for additional hours? Anytime that we submit the paperwork, we have to write up what we call a justification, letting the people that authorize the services know why they're necessary. So that's something that we do anytime we submit for additional hours. We just do it on our end, so you probably don't see that side of it, but we do that whenever we submit. Does EPSDT still have special situations that they can assist with, such as school-based care? Yes, they do. So that's still an option as well. That's just, you just contact your service facilitator and they can help you with that. So the doctor fills everything out, not the caregiver for the checkboxes. Yes, so you can communicate with the physician, but the physician's the one that needs to complete that form. It's basically like a referral form or prescription, so we need to make sure that they're the ones filling it out and that we're not filling it out and you guys aren't filling it out, but the physician is the one filling it out. The 40-hour per week per attendant max is still in effect as far as we know. So I think that got all the questions in the chat box. Oh, there's a few more coming through now. Can reauthorization requests for increase in hours be done at the same time? Yes, it can. And I'm not sure about the special situations regarding service dogs. Unfortunately, that's not something that we cover, so I'm not sure about that one. I'm sorry. Someone's asking about letters from employers for work hours. That can be requested. So if your service facilitator lets you know it's been requested, then you would need to get that. But it's not something that we automatically have to submit. These are some great questions, and I really appreciate all of you coming to attend this tonight and chatting with us about it. We really appreciate the opportunity to serve you. I know it's been a little bumpy here lately as we try to figure this out, but we are committed to all figuring it out together. We want to serve you the best that we can, and so when we don't know the answers, we try to seek to find them and share them with you all. And communication with your service facilitator is really the best way to go, because we that way they know your family, they're familiar with you, and they can try to get the answers and get back to you. And so if you have additional questions, I would really encourage you to talk with your service facilitator. There's also a lot of information on our website. So if you go to momsinmotion.net, we do have the blank DMAS 7 form as well as a sample DMAS 7 form. So those are both on our website. So that's momsinmotion.net. Make sure it's .net, not .com. And you can also contact one of our family resource specialists. So we have family resource specialists that answer the phones Monday through Friday, 9 to 5. And so their phone number is 844-828-5591. And you can always contact them for more information if you are unable to reach your service facilitator. But your service facilitator is definitely the way to go first, because they're most familiar with you and your child.
Hey Lauren, I just want to throw in one thing and just let you guys know that at the top of our website, there is a button to sign up for our newsletter. And so if you would like more information, and we may end up doing more of these special kind of events for parents and caregivers. And so if you sign up for our newsletter, you guys would get a lot more information about that.
Yes, thank you very much. So thank you all for the opportunity to talk with you and to serve you. We really enjoy our families, and we appreciate the opportunity that you guys have given us to interact with you all. And don't hesitate to reach out to your service facilitator at any time if we can serve you. So we appreciate you all, and we appreciate you taking the time to attend tonight. And we look forward to continuing to collaborate together. Thank you.